Okay, hi everyone, and welcome to another week of Bundle of Rays. And we are going to have a special week this week. This is the Reality Podcast. This is where we start to talk about reality, real people in real situations doing real things. And I can tell you, this week is pretty real. If you haven't heard of this little virus called COVID, then I'm sure you must be stuck in some cave somewhere. This week, we're going to be talking to some frontline staff in Madrid, Spain. And we're going to go ahead and get started. So, Raphael, hi, and welcome to the Bundle of Rays podcast.
Hi, Brad. Thank you for having me.
No worries, man. It's the world's pleasure, not just my pleasure. Before we begin, we probably should just do a little bit of introduction. I'll let you introduce yourself first.
Okay, so my name is Rafael. I'm actually Portuguese, but I live and work in Madrid, Spain. I'm a family physician, but I currently work in emergency medicine in Spain. I work in a medium hospital for Madrid. It's a 300 bed large hospital. I work in the emergency department, and I've worked there for like about 5 years. And yeah, it's basically it's in the south of Madrid, a very working class neighborhood. And yeah, it's pretty much for the last 2 weeks. It's been a COVID-19 hospital for yeah
Okay,
for
all
the last
right,
week
thanks.
maybe.
No trouble. So, just for our listeners, so our podcasting show is relatively new. We're about to launch
Hmm.
an online platform. My name is Brad Chesham. For people that don't know me, I'm a nurse. I currently work in emergency and intensive care in Australia, and I run an education company that's focused around virtual reality. But our podcasting channel that we do is very focused on people who are on the ground. As I said, doing real things. So that's me. And before we begin, I think we should just really acknowledge this sort of global situation that everybody's experiencing. You know, whether it's in Madrid or it's in Australia, then this is really touching the whole world. And personally, from one healthcare professional to another, I just want to commend you guys. You know, we're seeing the news from Italy and Spain and Iran and what's been going on in China, and you know, we can see that you guys are working hard, Raphael, and everybody is just in absolute awe of the efforts of what people are doing. And obviously, we're about to have a conversation and unpack exactly what it
Yeah.
is that's going on. But I'm just raising my glass. It's nearly 2 a.m. here in Australia, so I'm just giving you you and your colleagues and your team a big cheers. So congrats, you're doing a good job, and you're doing the best that you can. So let's just get into things, man. So when we look online today, you know, the internet can be confusing, and information has been confusing around COVID. That currently, some statistics, you know, in Spain, they're saying, you know, in total you have nearly 14,000 cases with 600 deaths. And in the last 24 hours, you've had nearly 2,100 cases and 90 deaths. Now, that's
Hmm.
a pretty escalating situation. How is it feeling on the ground?
Well, I work in Madrid, and Madrid has about half the cases in all of Spain. So for maybe a fifth of the population. So per capita, we do have a lot of cases, and Madrid is by far the hardest hit region in Spain. It's not even close because it's not that big of a region in terms of square footage. So it's been really tough. It's been like nothing else. It's been like I mean I'm relatively new in medicine. I mean I finished my residency 5 years ago, so I'm pretty new. But I've talked to a bunch of my senior staff, and nobody recalls anything even even remotely compared to this. So it feels like wartime. It feels like wartime minus the destruction. Like
Yeah. So
the number of the numbers are amazing.
okay, yeah. So you're not dodging bullets. There's not mortars coming your way, but you're covered in
Yeah,
PPE and yeah.
yeah. And you have, I think the casualties are as large or maybe even bigger than some wars. You just don't have the destruction of infrastructure, but it doesn't make it less cruel, because this is a very if I had to put two adjectives for this disease, it would be humbling and cruel.
Yeah.
It's very humbling because it makes you reassess all of your life, on all of your priorities, and all the problems you might have had in your personal life, as a society, as a I don't know. And then it's a very cruel disease because it's so contagious. You have to manage patients in PPE, and those that are the sickest need the need to be isolated, and some of them, a lot of them, end up dying alone because we can't. We shouldn't let relatives get close, because that would maybe that could worsen the epidemic. So it's a really cruel disease. Um,
Okay.
every day at my hospital, we try to talk with the relatives at least once a day, tell them how their relatives are doing, and people who have been in the hospital for maybe a week, it's been like a week since they last saw their relatives, and maybe they will never see them again because they will die, because there's nothing much we can do to save many of these patients. So yeah, it's very cruel.
Yeah, that sounds heartbreaking. Absolutely heartbreaking. So, how is the staff coping with this?
Uh, well, I guess you can have multiple answers for that. I can speak for myself
Yeah.
and a couple of colleagues that I've talked to. It's very very tough. I mean, nobody gets a pass on this situation. Uh, some are more involved than others. Uh, we've had a few rough moments, especially when we had to take care of a few colleagues that came in with well, not a very serious case of COVID, but just if they come with a fever and you just suspect that they have this virus, it's really heartbreaking because
Frightening.
like
Yeah.
a casualty. Yeah,
Yeah.
it's like a casualty.
Yep.
Like your team has one more casualty, so it's one less person to fight this epidemic.
Yeah, sure.
And
And have many of your team members been affected?
so that's actually one of the things that we at my hospital, at our hospital, we are the proudest, because we've been taking care of COVID-19 patients for about exactly 2 weeks. So our first positive patient was exactly 2 weeks ago, a Wednesday, March 5th or something like that. So it was actually 2 weeks ago, and we've seen. I think we have at my hospital around 200 confirmed cases, all in all. So that's just my hospital. So and to get you a perspective on the numbers, we have 200 patients with COVID, and this is at least a moderate case of COVID, because we're not really testing people with mild cases. So these are the patients who need to be admitted. So it's 200 patients, and we have a 300 bed hospital. So there's not a single situation where you have 60% of the beds in a hospital occupied by a single disease.
Yeah.
This is unreal. It's unreal.
Yeah.
So
can you tell me, are those numbers still increasing as the days go by?
yeah, and they're getting traction. You know, it's every day it's worse. So every day it's always worse than the day before. We're still on the upslope. I'm sorry, I don't know how to say.
Yeah, of the presentations. Yeah, I understand you. There's
Yeah.
an escalating
So,
part of the curve. Yeah.
Yeah, exactly. We are still on the escalating part of the curve. So yeah, we don't see the flattening of the curve as of yet. So, but as the point I was trying to make is that in all this time, we only had 2 people test positive for SARS-CoV-19, and both of them were yesterday. So it took us like 2 weeks of seeing a lot of patients for 2 people to get infected.
Yeah, that's pretty fantastic.
Yeah, that's. I was talking to a friend. He works in intensive care unit, and he was saying that's some pretty good disease control, whatever you call it.
Yeah, absolutely.
Yeah,
so tell me, what PPE are you actually wearing?
So we're wearing a waterproof gown.
Yep.
We use double gloves.
Yep.
One pair of gloves underneath the gown, and another one over the gown. We use an FFP2 face mask, and we use protective goggles. So we don't use the helmet. We don't use protective boots, and yeah, that's basically it. And
Okay.
a lot of hand hygiene.
Yeah, sure.
Like really strict hand hygiene.
Yeah, absolutely. So when you have 200 COVID patients in a 300-bed hospital, how do you isolate these patients?
You don't. You try to put COVID patients, like confirmed COVID patients with confirmed COVID patients, and try to isolate suspect COVID patients. And but it gets to a point where there really isn't any more space. So you go with your gut, and you see the very likely suspect COVID patients with the very likely suspect COVID patients, not yet confirmed, and that's how you get by.
Yeah, I suppose.
Otherwise, it's impossible. Of course, we try to maintain the basic social contact measures. You know, we give every patient a surgical mask. We try to keep them at least 2 meters apart. We try to minimize contact with these patients. So, for instance, whenever we have to draw some samples, we try to draw them all at once. So, if you need a blood sample plus the nasal swab, we try to do it all at once, so that nurses are only exposed to patients' fluids once. Also, we try to get every medication PO, so that as well to keep that contact with patients really low.
Yeah, sure.
Yeah, to a minimum.
Okay. Now,
of course, some patients are sick enough that you have to go IV all the way.
Yeah, sure, no trouble. I think one of the most fascinating things is that, here in Australia, I think even in the US at the moment, is that, we don't really see what you're seeing. And it would be really interesting if we can just pull apart your workday. You know, what time is it there in Madrid? It must be nearly 4 p.m. in the afternoon, and
Yes, it's
you've just finished.
4:20.
Yeah, so you've just
Yes,
finished a
I
day
finished my
shift.
shift.
So
Yeah.
let's just talk about your shift a little bit. Like when you go to work in the morning, you know, are you driving or catching the train?
Uh, Today I drove.
Okay,
Like
is there?
I usually take the subway, but we're currently on a government imposed lockdown. But there are still plenty of people that are working. So the subway is actually more crowded than
Mm,
usual. So I
okay.
try to avoid the subway. There are far less cars, that's for sure. Madrid is a pretty busy rush hour traffic city, but now it's really come down. That's for sure. But as this is another thing that this disease has, as almost all diseases, they have a social gradient. You know, people on the lower strata of society are more affected by it, even though it infects people all around. The consequences it has on your life affects those that have less more. Like if you're very well off, you might afford to stay at home. There are some people that really cannot afford even a 2 week period
Yeah,
without working.
yeah,
So and those are the people that take the subway every day.
yeah.
So they keep having to take the subway. So today I went with my girlfriend's car. Um, so I got at the hospital around 8, like maybe 10 minutes before, because we start our shift at 8,
Yep.
and uh, the thing is that ever since we started with the first patient, every day has been different because we started with one patient, then 5 patients, then
Yeah.
15 patients. So we used to have 2 people only for COVID patients. So mind you, every day in our emergency department, we have around 12 to 14 doctors working at once in the different areas of the emergency department. So the first day we had COVID patients. Of course, we had already a few days with the suspect cases. So because we wanted to isolate them as quickly as possible, we started a few days before we had our first case with a team of people dedicated exclusively to COVID patients, or at least suspect COVID patients.
Yeah. So
And
that's the kind of picture we
that
have here
team,
in Australia at the moment. That's probably
yes,
where we are. Yeah.
yeah. So that team that used to be 2 out of 12 or 13 is now uh, well, today it was 17 out of 18. So we had to increase the number of doctors per shift, and now like we have only one doctor to see the no non-COVID patients, which by the way, they they all end up being COVID. It's like every other disease just disappeared. Like I'll tell you, a patient today we saw. It was a 25-year-old kid with Down syndrome, and he came with abdominal ache and a fever. So we really thought he had appendicitis. I mean, it all pointed to appendicitis. We did some blood work, an ultrasound. The blood work was very non-specific. The ultrasound was negative, so we ordered a chest X-ray. What did he end up having? A
No.
pneumonia, like an interstitial pneumonia, very resembling of COVID. This was
Wow.
a mild case of COVID, but it's like there's nothing else in this emergency department,
Yeah.
or in Madrid for that matter. It's
So
unreal.
I suppose that's probably very concerning because people who are having chest pain or who have gallstones or who have some renal
Yeah,
damage are probably sitting at home and their general quality of life is probably being affected. But
yeah,
yeah,
yeah, yeah. So, for instance, today we have well, we are so bad that we are actually having other specialists come down to the ER and help us out. So today I was working with two cardiologists, like trying to explain what we do with this COVID patients, and we had a couple of neurologists as well, and we were talking to them like, where are the STEMIs? Where are the strokes? Where are the pancreatitis? Because we haven't seen a case like that in a couple of weeks. It's unreal. We really don't know what's happening. We're assuming that people are just staying home with those conditions, but I don't know.
Yeah,
it's really confusing.
I suppose that there could possibly be a secondary wave of sort of general medicine and surgical presentations in the next fortnight.
Yeah, for sure. Maybe you're gonna see like a lot of cardiomyopathy because people had STEMIs and didn't get treatment, and now they're left with a
poor moving ventricle. Yeah,
for sure.
So tell us, there's been a lot of talk that this is a disease of the elderly. What's the average age of people that you're seeing?
It's maybe around 70, 80 for sure. Like the majority of people are above 60 to 70 years old, and there are more 80 years old than 70. But we've seen this disease across all ages, starting from like 20s. We haven't seen it that much we don't see children at my we have a separate pediatric emergency department, but the pediatricians in our hospital tell us that they are mostly like seeing no patients at all, because it doesn't seem to affect children that much, or at least not symptomatically. So I think parents are afraid to take their kids to the hospital.
Yeah, sure.
So consultations for pediatric patients are way down.
Yeah.
So for sure, we're seeing a lot of patients that are maybe 70 to 80 years old, but I've seen like the most dramatic cases have been in people with 40 and 50 years old. The first patient I saw that ended up testing positive for COVID was a 45 years old man with a history of hypertension and asthma, but not like persistent asthma. He had like allergic asthma.
Yeah.
He wasn't even on medication, and I saw him a Saturday in the morning around 11 p.m. and 11 a.m. and around 11 p.m. he was intubated in the ICU, and I just learned he died yesterday.
Oh wow, that's horrifying.
And so he went from speaking with me and intubated in less than 12 hours. They tried everything, pronation, all the drugs that they're trying.
Yep.
Nothing worked. It was, and the sickest part of this patient, he was at our hospital like 36 hours before with a completely clean X-ray, and 36 hours before he was in a almost acute distress respiratory syndrome.
Yeah.
It's like unbelievable how fast it grows. I know this is like, I'm very biased with this case because it's a young man and it went down so bad. So I know that most cases are not like this, but it gives you a sense of how helpless
it still happened. Yeah, Yeah,
Yeah, it
absolutely.
still happened.
Yeah. So listen. So if you've got people like this young man who are quickly requiring a lot of resource. These
Mhm.
ICU patients require skilled staff, high tech equipment, a lot of medicines. If you've got 200 people in a 300-bed hospital, things like non-invasive ventilation or high flow. If
Yeah.
you're treating the hypoxemia, how are you managing the resources across the hospital?
So, well, as you know, non-invasive ventilation it's not really recommended
Yep.
in these patients unless you do it in a negative pressure room. So, in our hospital, whenever a patient needs non-invasive ventilation, they have to go to the ICU. So, our hospital has 8 ICU beds. So. Um, we're actually using the post-op rooms, the anesthesia recovery rooms,
Yep.
as ICU beds, and our intensive care specialists are working closely with the anesthesiologists. Although it's not the same, because anesthesiologists, I think, at least in Spain, aren't used to dealing with patients like so severe, especially in my hospital because it's a relatively small hospital. So our anesthesiologists are usually are used to mostly surgical patients, not medical patients. So
Sure.
it's been really tough because even though they have like ventilators and rooms and whatever, they are not used to this kind of disease. So our intensive care specialists have to like sing themselves, and try to help the anesthesiologist. It's really tough.
That is interesting. Oh, it's crazy stuff. So, listen, another interesting question about your workday today. Like, I'm not sure if you're getting an opportunity to have a lunch break, but when the staff do get a break, are you sort of all sitting together in a staff room, or are you still sort of practicing social
Yeah,
distancing when you're on your breaks?
yeah, yeah. We do. We try to keep social distance. Actually, I remember I was on call Saturday, and when I got to our staff room where we have the I don't know how you call it, the handover of patients,
Yes,
right?
handover. Yep.
Yeah. So when we have our handover, I got there, and there were a few colleagues of mine in the staff room, and I told them one of the things that is like affecting me the most in this pandemic is not being able to hug you guys. Like
Ah,
because you can't hug your colleagues because we're going through like a torture. It's like a mental torture what
yep.
we're going through, and even the patients. I've had to tell a couple of families that their relatives are going to die, and you can't hold their hands. It's really brutal. It's really brutal, and you have to
Mm.
tell them not to hug them in between themselves. Like it's a and you become paranoid, because you're thinking, is this really necessary? Do I really need to tell grieving families not to hug?
Yeah. Wow.
Does this
That's
make does this make a difference? It
yeah.
should, right? Because they are a high risk population. Their relative is just dying of COVID, so they must have it. So
Yep.
it's crazy. It's crazy,
Yeah.
and it drives you crazy. It drives you crazy because you don't know how to do
Yeah.
this
Well,
stuff.
I,
I
th-
mean,
I
nothing
think you're not
prepares you
alone
for.
there, Raphael. What we're going through is so fresh and so new, that it's amazing that we can have an opportunity to talk about these things.
Hmm.
Yeah. Um, so you've kind of answered this a little bit already for me. I was going to ask you, what things do you think that you're doing well? But we've already discussed the fact that the infection control measures that you have in place seem to be quite strong. You've got a low proportion of staff that seem to be contracting the disease, which is a huge commendation to your team and the efforts that you're doing towards increasing the vector and movement of the virus. So that's sensational. So is there anything else that you think the team is doing really well?
Well, I think you have to, like, everybody has their own responsibility, you know. So, for instance, I'm like a soldier in this battle. So I work in the field. So I shouldn't have to worry about people having separate bedrooms. I shouldn't have to worry about having proper PPE and masks and surgical masks and gloves. I should worry that I use them every time. I should worry that I wash my hands. So everybody has their own responsibilities in this. So my responsibility as a worker in close contact with patients is to be very thorough with my hand hygiene, be very thorough with my, how the guy leading the response team in the ministry here in Spain calls it respiratory etiquette. I really like that expression.
Yeah, yeah.
So I need to be concerned with my respiratory etiquette. I need to remember we use the surgical masks for everything, except when you go to the patient's room. Then you put on your FFP2 mask.
Yeah,
otherwise,
sure.
you use or unless you are in like a specific COVID area. We have specific COVID areas, or we used to have specific COVID areas. Now everything is COVID area. But for instance, when we are at our office, where we have the computers, there we use surgical masks. So I need to worry about that, and other people need to worry about other measures of infection control, right? So if I had to like give advice, I would say, so where are you? Are you a worker or are you a supervisor? What are you doing? Because depending on what you are doing, your obligations are differ. You know. So if you're working with patients, which will be most of people, I would say absolutely hand hygiene, like every a lot of times a day. I'm not a big fan of hydrogel. I prefer water and soap. I don't know. That's just my my preference. Always, whenever we see a patient, always FFP2 mask plus gloves. If you're suspecting that there are COVID patients, also wear the PPE.
Yep.
And extreme hand hygiene, and also protect the patient. Like, put a surgical mask on the patient, that will protect him and you as well. So that would be my advice, and that's what we've been doing, and that's what's been working.
It seems to be working. Yeah, that sounds great. Okay, so then the important question is: do you think there's anything that the world can learn from what's happening in Madrid at the moment?
Don't underestimate this disease. Don't underestimate this disease, because everybody has, and all those who've underestimated this disease. I mean, when was the last time that you had 5 or 6 European countries on complete lockdown?
The world is turned upside down now.
In World War II, countries weren't on lockdown. People were getting out of the streets. You know, people were doing their normal lives during war periods, unless they were in a specific war zone.
Yeah.
Here we have France, Italy, Spain, Portugal is probably going to be on lockdown, maybe today or tomorrow.
Mm.
A bunch of U.S. cities are going to get on lockdown.
Yeah,
It's
it's one interesting
unbelievable.
thing we've been talking about here in Australia, because they've kept the schools open, and there's a line of thought that if we close the schools, then healthcare staff will stay at home to look after their children, and there could be a limit to the application of healthcare staff because of the kids. Is that something that's you've seen in Spain?
Uh, Not really, not that much. Like, um, uh, healthcare people, healthcare staff are not going to stop this. You know, you can have like your entire healthcare staff dedicated 100% of the time to this, and it won't stop this virus. You need to engage all the population, because otherwise the virus will keep spreading, and there isn't a healthcare system in the world that is able to cope with a with an outbreak like this.
Mm.
So so health, healthcare system is not the answer. The answer is the people.
Yeah.
You need to involve everybody, especially um, young people, because more and more there's more and more evidence that young people are asymptomatic carriers and they help spread the disease. So you need to engage young people to keep social distancing, to stay home, to wash hands regularly, because they might not suffer it, but their grandma might, their parents might, their aunts might, their older relatives might, and
Yeah.
this is not gonna end unless get we engage with every single layer of the population.
Yeah.
Spain tried to do it on the good way, like recommendations, and basically every country tried to do it um, with a warning, but it had to come down to a lockdown,
Yeah.
because that's
Okay.
how serious this is.
Yeah, sure. And listen, I think there's another interesting question that a lot of healthcare workers have in countries like Australia at the moment, is that when you finish work and you go home, what do you do? Are the staff showering before they leave? Are they just washing their hands and going home? Because obviously people have
Uh,
got kids at home, people take care of their
yeah.
parents who are elderly. How are healthcare staff managing that?
So I don't know. I guess different people do different things. I think in my hospital, I don't think there are that many people that are showering before going home.
Yeah.
We do try to, like, every single one of us wash our hands before we go home. We do try to, especially I know my colleagues who have kids, they do try to shower as soon as they get home.
Yep.
In my case, particularly, I live with my girlfriend. My girlfriend is a nurse. She's also working now, so we are both healthy and young. So we do try to, like, shower as soon as we get
Yep.
home, just to try to avoid or minimize the risk of contact. But
Yeah. Okay. No worries. All right, Raphael. I don't have too many other questions yet. I think you've answered a lot of the concepts I wanted to cover. Is there anything else you want to add, or?
uh, I I I don't know. I think I've said it before, but this is a very humbling disease,
Yeah.
and if you're just starting to face it, uh, keep that in mind, and keep in mind that as you as the numbers grow, you're gonna make mistakes, because this is like nothing we've seen before. So we are going to make mistakes. Uh, Not so many like clinical mistakes, like this is a really simple disease to diagnose.
Yeah.
It's not a hard disease to diagnose, but it's a very, very hard disease to manage
Yeah.
because you need a lot of space, because it's very cruel, because patients get very sick very rapidly. So you're gonna make mistakes, and you're gonna find that what worked on day one might not work on their on day two or three or four or five. So you need to be willing to accept those mistakes, which might not even be mistakes. It's just that the situation has changed. So
Changed. Yeah, it's very
what
dynamic.
you,
Yeah.
yeah, so what you do on day one might not apply on day five, and that doesn't mean that what you did on day one was wrong. It just doesn't apply when you have five times more cases.
Yeah.
So be willing to learn from what's not working and take a step back and redirect your efforts.
Yeah.
For
Cool.
people leading teams, you need to be strong. Like you need to be know what you're doing. Give clear orders, but you really need to be humble and empathic, because this is very hard to deal with, and not everybody has like the 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 emotional tools to deal with this.
Yeah.
So some of your staff might take it better than others, and you need to be aware of that.
Yeah.
And we're trying to cut down some shifts so we can have more time to rest. Uh, uh, our our director, in our emergency department, our director, he's trying to tell everybody, whenever you're feeling down, if you want a couple of days off, just let me know. We'll get those shifts off of you, so you can readjust and come back stronger.
Yeah.
And of course, if you have symptoms, for sure you need to be tested and stay home. So don't be afraid to make mistakes, and just assume you make and just realize that this is a very complicated situation, and there's no shame in taking a step back and do things differently,
Differently.
because what you do now doesn't work. And that doesn't mean you haven't been doing things well up until this point. It's just
Yeah.
that this changes every single day. Like every single day, we have so many more cases.
Yeah, so
So
we're just talking about that curve before. I think Spain had
yeah,
2,000 cases in the last 24 hours. So if you keep
yeah,
following that curve, that's going to turn into 3,000 pretty quick.
yeah. So you need to be aware of that, and the sooner you act, the sooner you're gonna see results. Like we started our lockdown a couple of days ago. We might not see results for maybe a week or two. So if we had started uh, a couple of weeks ago, we might have seen results right now. I don't know. As I said, I think this is not the time to point fingers and blame nobody. We are in a mess like we've never been before. So now we need uh, people and solutions that add and not subtract. And after this is over, we for sure we're gonna need to analyze what worked, what not, what didn't work, what we could have done different, what we need as a society to be prepared for this, for a situation like this. So, but now is not the time. Now is not the time to say who is to blame for this situation. We are in it now. It's irreversible to be here. So now we need to work to get us out of here, and then afterwards we need to analyze it for sure, because we
Yeah.
really need to understand how in the 21st century, with all the available technology and science and scientists that we have now, we couldn't contain something like this.
Yeah, it's fascinating,
Uh,
isn't it?
yeah,
And
yeah,
we at the start of our conversation, we talked about the economic effects that people are feeling. You know, airlines are going to go bust. It's just looking at what the future looks like in 10 years' time, not just for people's health, but for the way that society is structured is just,
yeah,
it's something that, you know, we couldn't predict this. And at the moment, I don't think we can predict where we'll be in 5 to 10 years. So
yeah.
I think we might finish up here, Raphael. I can't thank you enough for taking the time to have a conversation with us today, and
All
the
the
world
best.
thanks you, mate. We plan on sort of sharing this pretty broadly across nursing teams, and my business is core focused on nursing on the ground. So you're dating a very special person there, mate.
Yeah.
All right,
Thank
listen,
you.
you take care. And as I said at the start of this conversation, you know, it sounds like you're doing a great job, and you make sure you take care of yourself, and the team takes care of you, and you just keep doing what you're doing, man. Sounds like you're doing
Yeah.
a good thing.
Thank you. Let's keep in touch so I can. I'm happy to try and help in every way I can, and give you more updates if you want from how things are going in Madrid, and if we do finally beat this thing, tell you how it feels.
Yeah,
Because
I'm sure it's going to feel good with a cold drink and a big cheers. But all right,
yeah.
listen, you get some rest, and I'm sure we can talk again soon. Thanks very much, Raphael.
Thank you. Thank you
No
very much.
worries.